Hi, Mr. Smith.
Good morning. Can you
I
hear
can
me
hear
okay?
Yeah, I can hear you great, actually.
Yeah, I have a new computer now, so.
Awesome. It must have been the computer then.
Yeah, apparently so, all right.
Awesome. Okay, well, I'm glad we tested it out. I'm going to start letting others in probably here.
Okay, I'll go on mute.
We still have plenty of time, so you can, turn your camera off, go on mute, and we'll see you in a couple minutes.
Sounds good. Thank you.
Thank you.
Testing 1, 2, 3. Testing 1.
Thanks, Dr. Morosky. We can hear you loud and clear.
Perfect. Thanks.
Good morning, Joseph. How about me?
Yes, Dr. Purnell, we can hear you. Thank you, sir.
Thank you.
Dr. Ponce, I see you just joined. Do you mind just doing a sound check really quick to make sure we can hear you?
Hello.
Hi, thank you. We can hear you loud and clear.
Good morning. Can you hear me, Joseph?
Yes, Dr. Azam, thank you. Can hear you and see you just fine.
Thank you.
Miss Bittner, I see you just joined us. Do you mind just testing your speaker to make sure we can all hear you? Judith Bittner.
I'm here.
All right, perfect. We can hear you. Thank you. Dr. Larson, I see you just joined us. Do you mind testing your microphone? Make sure we can hear you. Sorry, let's try that again. Dr. Larson, I see you just joined. Do you mind testing your microphone to make sure we can hear you? Dr. Larson, are you there?
Yes, I am here. Sorry about that. Technical difficulties.
No problem at all. Thank you. We can hear you and see you. Appreciate it.
Morning, Mr. Philippi. This is Jennifer Carr with the NDP. Can you hear me and see me okay?
Yes, Jennifer, we can hear you and see you. Thank you very much for joining.
Yep, no problem. Good morning, Mr. Philippi. This is Cheryl Fontaine with NDEP. Just checking microphone and camera.
Yes, Cheryl, microphone and camera are working. Thank you so much for joining us.
Thank you.
Hi, Joseph. It's Ted McDonald from Churchill County Health Department.
Thanks for joining us, sir.
Thank you.
Yes, we can hear you and see you.
Great.
And good morning to everyone. It is officially 9 a.m. on Friday, December 3rd, 2021. For the record, my name is Joseph Philippi. I'm the Executive Assistant for the Division of Public and Behavioral Health here in the state of Nevada. I'm going to go ahead and take a quick roll call of the State Board of Health members to just ensure we have a quorum and can start today's meeting. I'll go ahead and start with Chair Dr. John Pinnell.
Present.
Thank you, sir. And Dr. Jeffrey Morosky.
Present.
Thank you. Dr. Monica Ponce.
Present.
Thank you. And Mr. Charles Smith.
Present.
Thank you. And Ms. Judith Bittner.
Present.
Thank you. And Dr. Trudy Larson.
Present.
Amazing. Okay, we have a full quorum. We can go ahead and start today's State Board of Health meeting. I will go ahead and hand it over to Dr. John Pennell to start.
Thank you, Joseph. I call this Board of Health meeting to order on December 3rd, 2021 at 9:01 a.m. Good morning. I'd like to welcome everyone. We thank you for your attendance. Today's meeting was posted in accordance with the Nevada Open Meeting Law. A public comment period will be offered for each action item as it specifically relates to the action item being considered. All public comment not specific to today's agenda will be heard during the general public comment period at the end of the meeting. All public comment, both during action items and during the general public comment period, will be limited to 2 minutes. Due to time restrictions, agenda item number 8 is going to be heard after agenda item number 4 today. Agenda item number 2 is approval of the meeting minutes for August 10th, August 20th, September 3rd, and September 10th. If there's no problem, we'll take all of those together unless board members would like to do them individually. Are there any corrections or additions? I would like to add one correction. It doesn't necessarily have to be changed on this, but in the future, it says Dr. Pennell called for a motion to approve. It should say, or at least I try to say, I call for a motion. I leave it up to the board members to say whether they're going to make a motion to approve or disapprove. Is there any public comment? Hearing none, I'll call for a motion, please, on the minutes just read.
Move to approve, Jeff Morosky.
Second, Charles Smith.
Meeting approval has been moved and seconded. Is there any discussion? All in favor, please say aye.
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 Opposed, say nay. Abstain. The meeting minutes have been approved. Next item is our informational item from our regional health areas. And first up is Carson City Health and Human Services, Nikki Aker.
I believe Dr. Colleen Lyons is present as well from Carson City Health and Human Services. I'm not sure if she wishes to give the presentation today.
Yeah, I'm giving the presentation. I think Nikki's has time out, just trying to get everything set up there. So she has submitted our or her 13-page report, and I'm just going to give highlights. I think the big things for Carson City are that we're no longer utilizing the National Guard, and FEMA has also completed their work with us relative to things like COVID testing, providing immunizations. FEMA was doing a lot of the data entry into WebIZ, which was extremely helpful, but we have assumed all of those tasks now. At the end of November, we stopped offering community testing. We were not seeing a big demand for it. We are prepared to reinstitute community testing if that demand goes up. We're continue to help providers in the community with providing immunizations in smaller lot increments to make that possible for avoiding wastage. And also working with some other providers to be able to provide some more testing availability in the community, but we're not seeing a big demand for that relative to our call center. And I would also point out that Carson City's Social Vulnerability Index has qualified us for the federal government to pay for some of the testing services that are provided. In addition, I would say that you can see the new chronic disease division logo, and that the Nevada parade, thankfully, this year was held. And there were a number of people that participated. We had 30 different vendors that required our, they were all permitted vendors, but that was the most vendors we had seen in several years. So that was a positive relative to some sense of getting back to normal. And I find it interesting under influenza hospitalizations when people question whether masks make a difference, whether social distancing makes a difference relative to respiratory illnesses. We certainly saw that in 2019, we had 36 hospitalizations relative to influenza. In 2020, with mandates, social distancing, masks, et cetera, we had 2. So it does work. And I think that's what I would point out from the report. Oh, I do want to mention challenges. Our clinic division manager for actual services has moved on to a part-time position with the department. And so we are in search of a division manager for clinic services. We're hoping for an RN in that position. And we have interviewed one candidate, but are going to have to throw out a wider net for recruitment efforts in that regard. So are there any questions from board members regarding our report?
Thank you, Dr. Lyons. Any questions? Okay, thank you. Next up, we have Washoe County Health District, Mr. Kevin Dick.
Yes, good morning. Kevin Dick, District Health Officer for the Washoe County Health District. I'd like to begin with our November board meeting. We did not have a regular board meeting. We had a special meeting for a workshop for our strategic plan development. And we had a great discussion with our board, and we'll be bringing them back a strategic plan to approve in the December meeting. The focus for our efforts moving forward over the next year is going to be on organizational capacity and workforce development. We have learned, as many other health departments have from our experience through COVID-19, the need to further invest in our workforce and organizational capacity. We have approval or direction from the board as we're putting together our budget for next fiscal year to invest an additional $1.2 million toward that development of our organizational capacity. And fortunately, we're in a healthy financial position with our fund balance due to the influx of federal funding to cover the COVID response and the fact that we had to redeploy many of our staff to that COVID response. So we were able to pay those salary costs through the federal grant dollars for COVID and the local dollars that we had budgeted for those staff in their normal program areas were saved in our health fund. So we're investing that moving forward. The board also approved a direction of continuing to sustain the investment that we're making in health equity through CDC health disparities grant funding that we're currently receiving. That's a $1.5 million investment over 18 months. And we'll be sustaining in our budgets moving forward the 7 staff members that we're adding through that grant funding, which we're receiving through the state. And I think that's an exciting initiative for us. We are hiring a health equity coordinator. We will be hiring 2 community organizers to increase our engagement in neighborhoods in our community. And we'll also be hiring 3 community health workers that will work with our clinical programs to better engage our residents in those services and to be able to provide follow-up as well. And we're also adding 1 additional communication specialist position. So excited about all of those developments for us. Unfortunately, with the November board meeting for the strategic planning retreat, we did not put together staff reports that compiled all of our October program information. So the information I provided in my report to you is a little bit dated, so I apologize for that. We should be up to date for your next meeting. We also, at the October Board of Health meeting, the board adopted amendments to our regulations governing food establishments, and those are on your agenda later today. So I hope and anticipate that you'll approve those. And we have new regulations for permitting and fees for underground storage tanks that will be going to our Board of Health for possible adoption at our December 16th meeting. During the COVID response with our staff redeployed to COVID, and also having to do the SB4 inspections of resort properties, we had to end the contract that we had with the Division of Environmental Protection for underground storage tank program. And we now have the capacity to take that program back on. However, during that interim period, the federal funding to the state for underground storage tanks was reduced. And so we are working to approve a new contract with NDEP for the funding that's available, but it won't fully cover the cost of that program. And we have a fee of $875 per permit for underground storage tanks that we will also have going to the board as part of that package to be able to cost recover what's not covered by the grant funding that we'd be receiving. As far as our COVID-19 response, of course, we've been watching Omicron. I will defer to Dr. Azam. I'm sure he'll provide you with a briefing on that. But we've been trending downward in our cases. We seem to be plateauing currently at about 88 or upper 80s of new cases per day on our 7-day average. We're at 115 cases per 100,000 over the past 7 days. So that puts us in the high transmission category with CDC and with the governor's mask directive. And what we've seen is an increasing positivity over the past week. We're currently at 12.76 positivity, testing positivity over the past 7 days. And I attribute that in part to the reduced demand for testing and testing availability over the past week with the Thanksgiving holiday. So we would anticipate that the positivity rate would go up as fewer people are being tested, and those that are getting tested because they're symptomatic are the ones primarily going for testing. We continue to make progress with our vaccinations. We're at 60.76% of our 5 and older population that's fully vaccinated now in Washoe County. And we've had 68.44% of our 5 and older population that have initiated vaccinations. We will be demobilizing the drive-through pod that we have been using at the Livestock Event Center for vaccinations. The December 17th will be the last day that we operate that. The National Guard, which have helped to support that, will be demobilizing on December 13th. And we're very grateful for the assistance that they have provided us. We'll be moving vaccinations inside and offering those through our clinic operations. We'll also continue to do community vaccine pods, and we're working on a number of locations that we hope to use on a recurring basis for those community pods. And we'll also continue to operate the testing that we're doing out at the Livestock Event Center 3 days a week, Monday, Wednesdays, and Fridays. Just one other note, we are seeing a high number of RSV cases occurring, much more than we usually do this time of year. And this is a national phenomenon that's happening. We've had 175 RSV cases reported over the past 4 weeks, and approximately 85% of those are occurring in children 0 to 4 years old. That's the end of my report, but I'd be happy to take any questions.
Thank you very much, Mr. Dick. Are there any questions from the board members? Thank you, sir.
Thank you.
Next up is Southern Nevada Health District, Dr. Lagoon.
Hi, thank you. Good morning. Yes, among other things, I want to share with you that our health district is right now working in the remodeling of one area of our main facility at the Cattle Boulevard, where we plan to build an area that will be dedicated to behavioral health. So that will be a behavioral health center within our facility. And this is facilitated by a HRSA grant of $600,000 that hopefully should be finalized before the summer of next year. We are also looking at expanding our capacity in our public health lab. We are looking at ways to expand the diagnostic capabilities there, but also looking at the space. We have certain constraints there. We just trying to figure out how to expand capacity in that building so we can respond to the needs of our community. The last 2 years have been very challenging for this community in terms of testing and the support our lab provide to our residents and all the medical community. And also it has resulted, I would say, in perhaps excessive expenses from the county because of our inability to provide enough testing from that lab. We also recently, actually about 2 weeks ago, we opened a new facility, actually replacing the previous facility that we moved out this month. It was a partnership with the city of Las Vegas, and this is going to be a community clinic that will deliver a limited primary care services, immunization, sexual health, and other services required by the community in the city of Las Vegas. And also we are in the process of a new construction project that will be finalized by early 2022, and this will be a permanent location for our health center that used to be in East Las Vegas. So this will be a new facility that will be open somewhere between, we assume that will be around March 2022. In terms of COVID, the incidence of COVID in our community has been decreasing, but very lightly. It's almost at a plateau level right now. The last 4 to 6 days, we have seen a smaller number of cases reported, but also when we look at the number of testing done in the last 5-6 days, I mean, pretty much Thanksgiving week, the numbers were very low. Typically, in our area, we have during weekdays somewhere between 6 to 10,000 tests a day. Last week, it was somewhere between 1,000 up to almost 4,000. So what it means is that, of course, we most likely miss a lot of cases that it might start to show up somehow during the course of this week. So I really don't trust the number from the last 4 or 5 days because of that aberration. Our positivity rate went up the last week. Again, I would say as a result, a smaller number of testing. Another issue that we are seeing with testing, and we mentioned that earlier this week with our state partners, is that as the number of available home testing kits increase, and also the number of antigen tests or PCR tests at the pharmacy level or at any community level start increasing, it has a negative impact in how we look at the positivity rate, because now what is happening is that most of the people who test positive through those home-based tests or other community tests, they most likely go to our testing sites and they for a confirmation. So for each positive case that we get out of that group, we are missing hundreds and thousands of people. So that's something to keep in mind. We also have been working with contractors locally in order to increase availability of testing sites in the community, especially out of concern for the vaccine mandate that might come across. And if employers start asking the employee for testing results, well, we want to be able to at least facilitate part of that, part of the solution to that. We won't be able to fully answer that need, but we want to make it easier for as much people as possible if they go to that need. In terms of vaccination, we have administered in Southern Nevada about 2.7 million vaccines. Almost 65% of Clark County population has initiated vaccination, and we have about 53% of the population fully vaccinated. Something that we have in common with Washoe County that they just mentioned, the demand for vaccine is really low, whether it is for boosters or initiating the vaccine. We are trying, messaging, communicating through multiple venues. So far, I wouldn't call that effort successful because it's not reflected in the demand that we see from the community. Last month, we have a meeting with representatives of the African American community here in Clark County, which the main objective was to increase people understanding of the need for testing, vaccination. We here in Clark County, when we look at the vaccination rates through the different racial ethnic groups, the African American community is the one that shows the lowest rate of vaccination. So we want to increase our communication, our partnership with representatives of the African American community. That meeting, would say, was successful. We were able to meet with more than 30 representatives of the African American community, whether it was from the faith community, but also from other small businesses and elected officials. So that was something that was very positive. I also want to share with you that the Southern Nevada Health District is offering COVID vaccination at our main facility in Decatur, and we are also offering expanded hours during the evening and weekends. Also, locally, UNLV is offering testing and vaccination at night. Actually, is Sunday through Thursdays, 5 to 10 p.m. And in addition to that, we have multiple vaccination sites at the 3 College of Southern Nevada locations, as well as several schools from our Clark County School District and other locations across the valley. I also want to share with you that yesterday was the World AIDS Day, and as part of those celebrations here in Clark County, the Health District opened a new sexual health HIV clinic in partnership with the local church. This is the All Saints Episcopal Church, and we will be offering HIV and STD testing and treatment at that location, as well as pre-exposure prophylaxis, and also we will offer telehealth services from that facility. We feel that this is a great partnership, and also it just helps us bring our services closer to the community, because we understand that there are segments of the population that, for many reasons, they just don't feel comfortable coming into the government facility or the health district or health department facility. So we're trying to channel that, in this case, through the church, which is a place where many people feel more comfortable, and so they can access that. And finally, also, I want to share with you that yesterday, as part of those celebrations here in Clark County, in partnership with the state and our local providers and partners, we had a ceremony for the grand opening of the Nevada participation in the Fast Track Cities Global HIV Dashboard, and this is something that actually contributes to share HIV/AIDS information from the state of Nevada with the rest of the world. And I will stop here for questions. Thank you.
Thank you, Doctor. Are there any questions from board members? Thank you, sir. Dr. Assam, State of Nevada, Chief Medical Officer.
Good morning, Mr. Chairman and esteemed members of the board. Good morning, everyone. For the record, Aizen Azam, State Chief Medical Officer. You already have a copy of my report, so I will just summarize most important points. The unvaccinated continue to drive COVID cases, hospitalization, and death in Nevada and nationally. Discrete improvement in COVID morbidity and mortality was observed over the past few months. However, as you just really heard, the cases seem to be increasing again. Even though test positivity rates started to slightly increase, opportunities to slow down and stop this current wave, or probably make it one of the last major surges of this pandemic, continue to be feasible. COVID vaccines are very safe and very effective. More people age 5 and older are now eligible to receive these vaccines. CDC already expanded their recommendations for boosters, and new oral antiviral medication seem to be effective. However, there are still many reasons to be cautious. The highly infective Delta variant continues to actively circulate, and now the newly detected Omicron variant is spreading. With such a low intake of the vaccine in the US and a very low vaccination rate worldwide, the risk for even more dangerous variants to emerge seems to be inevitable. The Division of Public and Behavioral Health strongly advises all eligible Nevada residents to fully vaccinate as soon as possible and before the emergence of even more concerning variants. As you recall, significant uptick in the number of COVID cases occurred around the holidays last year. So we need to be prepared for similar trends, especially if vaccine rates continue to be that low in Nevada. As COVID continues to circulate without interruption for almost 2 years, it's important to start planning to shift our collective response to an endemic mode. Nevada residents need to protect themselves by getting fully vaccinated and receiving the booster shots when appropriate, and by complying with face mask use and practicing other preventive measures, which can also reduce the risk for influenza and other infections. Now I will briefly update you on the current status of the pandemic in Nevada. Between 400 to 900 newly confirmed cases of COVID are reported in Nevada every single day. There have been about 5,586,000 COVID tests, with 460,000 Nevadan having confirmed COVID cases. So far, more than 1 in 7 Nevadans has tested positive for COVID, and test positivity rates have risen from a low of 6.3% in late October to 7.3% yesterday. As vaccines are keeping most people out of hospitals, death rates are currently much lower than those observed last summer. So far in Nevada, we have 8,050 COVID deaths. Just in the past 3-month period, since our last board meeting in September, Nevada added about 68,000 newly confirmed cases of COVID, and 1,780 COVID deaths were recorded. COVID vaccines continue to be performing very well against the widely circulating Delta variant, and vaccines continue to be our best defense against the newly emerging Omicron variant. As the brief natural immunity developed after recovering from COVID infection is unreliable and does not provide adequate protection, full vaccination is strongly recommended for all eligible individuals. Even the solid vaccine-induced immunity seems to gradually wane over time. That's why CDC and the Department of Health in Nevada are strongly recommending booster shots for all fully vaccinated adults. To date, more than 3,636,000 COVID vaccines or vaccine doses were administered in Nevada, and so far about 62% of Nevada residents aged 5 and older have initiated their vaccination, and almost 53% completed their vaccination series. Seasonal influenza is upon us. This season is coinciding with the heavily circulating COVID, highly infective Delta variant. It seems that our quadrivalent influenza vaccine is a very good match this season and can provide good protection against the currently circulating influenza viruses. As the activity of influenza circulating viruses is increasing, full COVID vaccination, in addition to receiving a flu shot, is critical, especially as we head into the busy winter holidays. With this, I'm concluding my remarks and will be happy to answer your questions. Thank you.
Are we allowed to ask a question if we're a citizen, or is this only board members?
This is just
This is only board members. Are there any questions for Dr. Azam from the board? Thank you, sir.
Thank you.
Next agenda item is number 4, consideration and approval of variance number 728 regarding the COVID-19 mandate for Nevada's System of Higher Education, INSHE, institutions under emergency regulation NAC 441A.755 for exemption waiver submitted by Cameron Matthew Rose. Dr. Azam.
Thank you, Mr. Chairman. For the record, Aizan Azam, State Chief Medical Officer. The applicant requested that the State Board of Health grants him a variance waiving the requirements of the emergency regulations adopted on August 20th, 2021. These regulations required any individual enrolling in a Nevada University, community college, or state college on or after November 1st to provide proof of a completed COVID vaccination series. Since March 2020, COVID infected almost 460,000 Nevada residents, including 8,050 deaths who needlessly died because of COVID. The pandemic is ongoing and COVID continues to spread, replicates, and actively mutates. Unvaccinated individuals are driving cases, hospitalization, and death due to COVID in Nevada and nationwide. The applicant asserts that he is against all pharmaceuticals unless there are no other alternatives. He also asserts that compliance with the mandate will result in him becoming homeless. It is unclear from the application how compliance with the mandate will result in the applicant becoming homeless. Statement in the application seem to suggest that the applicant has a philosophical objection with the COVID vaccine and more broadly with all pharmaceuticals. Such philosophical objections do not create an exceptional or undue hardship which would justify a variance. The emergence of highly infective lineages, such as the Delta variant and just recently the Omicron variant, increases the risk of COVID spreading in both the homeless communities and the educational institutions. Unvaccinated individuals can transmit the infection to other students and staff. According to CDC, FDA, and many other national research, COVID vaccines are safe and effective. Under the most intense safety monitoring in history, more than 432 million doses of COVID vaccines have been administered in the US. CDC recommends all eligible individuals receive a COVID vaccine as soon as possible. Additionally, it has been determined by the governor's medical advisory team and the Nevada Board of Health that COVID vaccine is necessary for the safety of all INSHE students and staff. So the intent of the regulation is to protect all students and staff at the INSHE institutions. Vaccinating all eligible individuals is the only way to control this pandemic. In asserting a philosophical objection to COVID vaccines or to the COVID vaccine mandate, the applicant has not established the exception or undue and unique hardship. Philosophical objection to the COVID vaccine, or more broadly, all pharmaceuticals, does not constitute a unique circumstance which would justify granting a variance. If granted, this variance would cause substantial detriment to the public welfare and substantially impair the purpose of NAC 441A, Chapter 755. Denying this variance is consistent with CDC recommendations and would be in the best interest of the applicant himself, other students, and staff at the INSHE and the Nevada community as a whole. Receiving the COVID vaccine is the only way to protect the applicant and others from contracting severe COVID infections and transmitting it to other individuals or even dying from it. It is recommended that State Board of Health deny the variance for case number 728. With this, I'm concluding this review and will be happy to answer your questions. Thank you.
Thank you, Dr. Azam. What I'm going to do for this particular item is let the Board of Health ask you questions. We'll let the applicant speak for a few minutes and the Board of Health can ask him questions, and then we'll allow public comment at the end of that. So are there any questions for Dr. Azam from the board members? Okay, hearing none, Mr. Rose, I remind you that the board has read your application and I'd like to give you a minute to go ahead and talk, maybe address some of the things that Dr. Azam said about becoming homeless, how that would happen.
I appreciate everybody being here today and thank you for hearing me. I would like to disagree with the assessment of Dr. Azam. The reason I would become homeless is prior to before starting school, I was homeless. I have been homeless for a long time of my life. By getting into the University of Nevada, Reno, it got me out of being homeless. I am at the university right now in housing. I have been in housing since fall of last semester. I've had no issues with any of the COVID stipulations. And in fact, we have drastically transgressed away from our original stance against COVID. As for example, I used to not be able to have visitors at the dorm. I now have the ability to have visitors and stuff. I'm having no ability or problems with the school when it comes to vaccine stuff. With the flu in all the COVID testing stuff to make sure that's all it was, which I was free and clear from. But the reason that I would be back to being homeless is because if I do not take this vaccine then and am not and avoid the mandate, I have no other options but to go back to the streets. I have no other place to go. So it's not a philosophical objection. It's by losing my housing and by losing my ability to be enrolled in the school, I have no other option but to go back to the streets. And I do not see where the vaccine is actually going to be beneficial, not only for myself, but my peers, because as we can see, even those who are vaccinated can still get the COVID vaccine. There's no guarantee that you're exempt from it. There are other ways without me having to get the vaccine mandate that I could continue school without having to be forced into this circumstance. And I don't believe that it's necessary.
Let me ask you a question,
Yes.
Mr. Rose. It seemed like in reading your application that early on you had an adverse event, maybe to a biologic. Why not just go for an exemption rather than what you're doing now, a medical exemption?
So I went for the variant. So I've been self-educating myself in the law. While I was homeless, I started educating myself and I started practicing. So that's what I'm working towards. And in my search, I don't feel that my understanding, the only way you can get a medical exemption is pretty much you have to be allergic to it, and that's it. So, and it's my understanding, I don't feel that a medical exemption would work. We have investigated getting a PTSD related one, but from my understanding, there's no basis for this, not basis on this understanding that I couldn't get it. I definitely have that, just more that it's an untraversed road. It's never been done before.
Okay. Let me go ahead and open up the questions from the board members to you,
Yep.
sir. Okay.
Yep.
Are there any questions from the board for Mr. Rose?
Mr. Rose, is Dr. Morosky. There are other vaccination requirements for freshmen to attend the University of Nevada, Reno. Did you receive those vaccines?
I had, prior to being in school, because we've done all those vaccines, I was vaccinated. I do think, though, that there is a huge difference between trying to compare stuff that has for years been approved and something that has just been new. We don't even know for sure that it's working. We're trying to say that it's working and it's working, but as we can see, there are still people, rates are still going up. We still have, because I was here for the early parts, I heard about those numbers. Those are still going up, even though we have these people vaccinated and stuff. I do not think it's the same thing. As far as I'm concerned, it's an experiment. Like, that's what we're doing. We're experimenting and hoping it goes right. And as far as I'm concerned, it's not going to make a difference if I get the vaccine or if I don't, because if I catch COVID and I'm on the streets, it's going to be 10 times worse. And that's not going to make a difference whether I'm vaccinated or not, because the vaccine is not guaranteeing that I'm not going to get COVID. And in fact, that's one of my problems that I've had with it is everybody I know that has gotten the vaccine has gotten sick with COVID. I think that's an issue, and we need to be questioning if maybe the vaccine is compounding the issue of rising cases of COVID.
Mr. Rose, hi, this is Dr. Larson. I have a question for you. I'm very curious, like, when did you develop this philosophy of not using any pharmaceuticals?
That's a very good question. So this is a very long tradition. This is an over 20-year you can call it philosophical. I'm not going to object to that. I grew up on pharmaceutical medications, psychotropic medications. I in fact have tardive dyskinesia due to the extensive use of pharmaceuticals. In fact, by the age of 16, I was taking 300 milligrams of Thorazine every single day and functional like having this intelligent, coherent conversation as I am. That's why they took me off of it, because they're going like, this is absurd. Because of the massive amounts of drugs that I was forced on as a kid, I am anti-drugs completely. Like, I need to see a reason, and it needs to be clear that this is going to work. And so I made clear earlier, if I could be guaranteed that I wouldn't be getting COVID and that this was actually going to do something, I would go take the vaccine, because I'm getting a guarantee it's not going to happen. I'm not getting this guarantee. I don't see anything happening. All I'm seeing is if I don't take this vaccine, I'm going to be left with no other option, because I can't continue school, to go back and being homeless. And I don't think that's very, respectable. And that is a definite hardship and exceptional undue circumstances, because like, it's be homeless or get this vaccine and continue school. Why can't I continue school? Because even if I don't get the vaccine mandate, it's not going to spread this vaccine or the variant anymore, and I'm not going to make it so that faculty or students couldn't continue their education as well.
Thank you. Are there any other questions from the board members for Mr. Rose?
Am I allowed to comment on this, or is it only board members?
Yeah, you're coming up. Hold on. Hearing none from the board members, I will open it up to the public. I'll remind you that the public is limited to 2 minutes. You'll see a time clock. Also, this is public comment. It's not question and answer. Okay, go ahead, Joseph.
I apologize. I will restart the clock. If you do have a comment related to this agenda item specifically, please go ahead and unmute yourself, state your name for the record, and I will start a timer.
I do.
Okay, thank you. If you can state your full name for the record, and then we'll start your time.
My name is Elizabeth Hammock, and is that all you need? Okay,
Yeah.
Long story short, I want to speak on this young man's behalf, because I think this sweeping mandate is a bad idea to begin with. And I know that the Pfizer just released their trial data by court order about a week ago, and they had 158,893 adverse events: nervous system, musculoskeletal, connective tissue, gastro, skin, respiratory, spontaneous abortion. That's just part of the list. And I think this young man is smart by doing his own research. And I don't think that any of you can guarantee that he will not have an adverse event by coercing him into this. But I just want to go on the variance rules themselves. First of all, Mr. Azam, I apologize, I'm very nervous. I've never done this before. He says the vaccine is very effective and safe in his reply, reducing and preventing severe infections, hospitalizations, and death. but we know that it does not prevent severe infection or hospitalization or death because the Southern Nevada Health District report just said there were multiple deaths in the vaccinated. So it's not effective and safe for everyone, and you don't know who will have an adverse effect. The CDC and Dr. Fauci have also told us that it does not stop contracting or spreading of this. So I feel that this could cause undue hardship to Cameron if it gave him myocarditis, maimed him with a neurological disorder, or any of the other 30,000 adverse issues that have been reported to the VAERS system. Thank you.
Thank you, Elizabeth. If anyone else would like to give general public comment regarding this specific agenda item, if you could please raise your hand and we'll go ahead and give you your 2 minutes. If you're joining by phone, you can press *9 to raise your hand and we'll call upon you.
What if we don't have a place to raise our hand?
Or if you're joining by the computer, you should have an option to raise your hand, but I see Casey Rogers. All right, thank you. Give me 1 moment to pull up the timer and then we'll start your 2 minutes. All right, Casey, go ahead.
Casey Rogers, CASERRODGERS for the record. I am in complete agreement with Elizabeth's last statement as well as in favor for Cameron. I think it's completely tyrannical what is happening in our state right now, especially knowing the adverse effects that this has done to people. And you guys keep saying that it's safe and effective when in fact, the conditions of people are underreported, and we know it's only reported at 1%. And at the numbers that are already in the system, you guys should have halted this and quit continuing the lie and the propaganda for forced inoculation, especially when we have other treatments available that are inexpensive. Therapeutics, especially like ivermectin, which Dr. Pierre Corey had told you guys to a Senate committee in the United States of America on December 2020. So this propaganda, this lie, this safe and effective is invalid, untrue. This is not a vaccine, it's a gene therapy. And the CDC changed the word of vaccine recently to accommodate this gene therapy that is harming people. Absolutely unacceptable. And each and every one of you know it. Look up your Nuremberg codes because we, the people, know what's going on.
Thank you for your comments, Ms. Rogers. I do see another person just with the letter N has raised their hand. If you want to go ahead and unmute and state your name for the record, you'll have 2 minutes.
My name is Nancy Jones, and I'm a representative of Health Freedom Nevada. I appreciate the opportunity to speak at this meeting, and I would like to remind this board that all of the current COVID vaccines available in the United States are under emergency use authorization. The only FDA-approved COVID vaccine is Comirnaty, I believe that's how you say it, and it is not currently available to consumers in the United States. So mandates, requirements, regulations requiring people to get this vaccine are illegal according to United States law. Parents are responsible to make health and medical choices for their children, and adults are responsible to make health and medical choices for themselves. No medical treatment should ever be coerced or forced or mandated upon anyone. And as has been demonstrated by the 2 previous comments, the notion that these vaccines are 100% safe and 100% effective is false. It is propaganda and it is untrue. These vaccines do not prevent infection or transmission of SARS-CoV-2. They are advertised as a way to reduce symptoms and severity of illness in the injected person only. That means that a COVID vaccination cannot be represented as a public health measure. You do not have to protect the vaccinated from the unvaccinated. It is simply a personal medical choice, and it should have always been that way. And this mandate needs to be completely reversed for NSHE. And in Mr. Rose's case, the variance should be granted immediately. Thank you.
Thank you for your comments. Looks like Charlotte Stewart has their hand raised. You want to go ahead and unmute? You'll have 2 minutes to give your comment today.
Okay, My name is Charlotte Stewart, and I kind of just want to go with what was said with the previous comments. The vaccine does not prevent transmission. In fact, the vaccinated often bear symptoms of COVID after being vaccinated, increasing the spread. The only lasting claim the vaccine has is that it might reduce symptoms. How is it reducing transmission? It isn't. One could argue that the reduction of symptoms could be increasing the spread of COVID. In fact, places with the highest vaccination rates have the highest COVID cases and severity. In fact, places with the lowest vaccination numbers have the lowest number of cases and severity. Fact, places using ivermectin have the best outcomes. Ivermectin is still an approved treatment. It is safe and effective, and therefore there is no need for unknown injected therapeutics with grave side effects. Fact, people have had COVID and not been vaccinated have antibodies, which are safe and more effective against the COVID cases. What you guys are doing is you're completely ignoring anything that goes against the vaccine. This amounts to crimes against humanity. If you guys continue, you will be held accountable. Thank you.
Thank you for your comments. Dr. Pinnell, I'm not seeing any additional hands being raised for public comment.
I'd like to comment, but don't know how.
Okay, thank you, Ms. White. Go ahead and state your name for the record. You'll have 2 minutes.
Valerie White. I support and hope that you allow Mr. Rose's variance, but I would also hope that you do it for any student who requests to be excused from taking this vaccine, which isn't a vaccine. The previous speakers were very clear and provided data and factual information, including information from the CDC, it should convince you that these shots should not be mandated. There are so many reasons not to force people to do it. They're not effective. You're going against reason and logic by insisting that all students be jabbed. I would ask that you allow Mr. Rogers to decline this vaccine, but any other student as well who doesn't want to take it. If somebody wants to get the jab, let them, but don't force people who have reasoned and who are in charge of their own bodies. This is just tyranny. And the last speaker who said, you will be held accountable. You're forcing inhumane, illegal mandates on people. I'm just wondering when your humanity is going to step forward and say, this is wrong. I keep hoping for someone to be courageous enough to go against the CDC and the World Health Organization, all their lies and propaganda. When are you going to stand up for humanity? That's all.
Thank you for your comments. Heather, you have your hand raised. If you can state your name for the record, you'll have 2 minutes.
Heather Kamami. So I've listened to some of these things and have heard some stuff, and I know that the health boards in lots of tyrannical states like our state with Kevin Dick and Sisolak being pro mandates, and you don't care about VAERS, you don't care about Nuremberg Code and all that, and no one acknowledges that even though we are FDA, Pfizer stuff, they're still in phase 3 trials, which means they're still experimental because the experiment is not over. But the point is that this is a brand new vaccine that is still undergoing phase 3. All the vaccines that we currently give to students that are required to attend school are decades old. They are not brand new. They have been put through the ringer. We already know the long-term effects on those. We already know that they are safe. We're still figuring that out with these new mRNA vaccines. We're still learning about it. They're still under trial. They're still in phase 3. It hasn't been 10 years. It hasn't been 20 years. It's unconscionable for the health department to even consider mandating this for students, especially and kids that are 5. We have no idea if the vaccine will or will not make them sterile. And therefore, if it does, if we learn that in 10 years from now, think of all the moms and dads that won't get to be grandparents, because if you guys approve this and mandate it, that's just.
Thank you for your comments, Heather. We'll move on to the next person who raised their hand. Renee, if you want to go ahead and unmute yourself, you have 2 minutes.
Hi, this is Renee Chaffee, ReneeChaffee. I just want to go on record that I agree with the guy who is with UNL, our University of Reno, and he's going to get kicked out, and all the great speakers that have spoken, giving you tons of data that I'm not going to repeat. I also want to go in record and say that I've never spoke at one of these meetings before. I've always sent in public comment. I have email tracker, and you guys have yet to open that email. That makes me really worried. Also, that I just don't understand the mandate purpose. If we all know that people who are vaccinated can also get the COVID and transmit COVID. The vaccine that was rushed and made was in 2019. Viruses replicate. That's why they make a flu virus every single year, because variants changed. COVID has replicated over probably 250 times. So why are we mandating a 2-year-old product for our children to have an education that we pay taxes for? My children are vaccinated. I will never let them go to make them have an education and risk their health ever. I already did that. And you know what? It makes me not trust the doctors, because as I was in there every month and my child had chronic bronchitis and allergy-induced asthma, I was the one that was taking care of them. They have no liability. You're pushing a product on children that have no liability. It is wrong. And you guys need to look into this. I'm done.
Thank you for your comments, Renee. We'll go on to Ken King. If you can state your name for the record, you have 2 minutes.
Hi, my name is Kathy N. King. I am a resident of Reno. I'm a wife, a mother, a nurse, a medical practitioner, and I'm a future grandmother. I strongly oppose the COVID vaccine mandate for all Nevadans. As I sit here before you, I feel strongly that we are standing at the brink of global totalitarianism. I realize that it will not matter one bit if I throw any facts, data, statistics, or science at you right now, for it will fall on deaf ears. I agree 100% with everything that every speaker has said before me. For decades, academics have done inquiry into mass formation psychosis. Our society is sick right now. We have fallen into a hypnotic state. Our communities have been fragmented and nothing makes sense anymore. People have lost their ability for rational thought. Our leaders can say anything they want and people will believe it. And anyone who says anything contrary to the narrative will be attacked. This is the consequence of censorship and propaganda we are subjected to. There is a bigger threat here than a virus. We are on the threshold of a loss of body sovereignty and personal freedom. In the last year and a half, the pandemic has not affected life expectancy, but lockdowns have. We have covered our faces with masks and we have lost control over human expression. Children's IQ levels have fallen 25 points over the last 2 years. Is this the world we want to live in? When does this infringement on our personal freedoms stop? I ask you today to take a moment and envision the world you want to live in. I feel a deep sadness for the children who are growing up and living in a world of fear, anger, and submission. It no longer feels like the United States of America. It feels like the divided states of America. Let's stop the games and charades and let Nevada stand for truth, sovereignty, and freedom. Let us return Nevada to the land of the free and the home of the brave.
Thank you for your comments. Monica Marquez, if you want to go ahead and unmute yourself, you'll have 2 minutes.
Hi, I'm Monica Marquez. I am a mother of 4, and I just cannot understand the mandates. There is no reason for them. This is a personal choice, and it should be a choice. We're already masked. We already make the choice to wear a mask every single day. Some of us even against our health issues, having asthma, whatever it might be. This mandate is ridiculous. It's disgusting, and it needs to go away. This is not communist China. We need to stand up for ourselves. We do have the freedom to do whatever it is that we want. And it feels like little by little, inch by inch, they keep taking our freedoms. They keep coercing us into a corner, into doing things, I don't know if you guys know, there are fake cards on the rise. People are choosing they would rather go to jail than get this vaccine. Kids have no right even thinking about a vaccine that has to go into their body. The HPV shot, it was introduced and it was passed within 4 days. Vaccines should be a personal choice. We still live in Nevada where we have a religious exemption. It is against our religious beliefs to not put fragmented DNA into our body. We don't know anything about this mRNA vaccine, and we can't even begin to describe what it's doing to people. The VAERS reports show it crystal clear what's going on with heart diseases, with Bell's palsy, with seizures, uncontrollable seizures. My kids are vaccine injured with seizures. To think of an adult, what they are experiencing, what 2-year-old, 3-year-old kids should not be experiencing is not acceptable. We are in Nevada, like the previous person said, this is the land of the free. If there is no mandate, or if there's a mandate in place.
Thank you for your comments. We'll move on to the next person with their hand up. It says Nail G. If you can please unmute yourself and state your name for the record, you'll have 2 minutes.
Kelly Adkisson for the record. I just want to say that we submitted a notice of maladministration to the Nevada Board of Health. Not only had we sent in 150 of them, but you also received them by jot form. I'd like to read a few statements from that. The people don't have to provide an exemption in order to be free from a mandate, mask, vaccine, or testing, if that person's faith prohibits him or her from doing so. Furthermore, take notice that in a Republican form of government, you are never given authority to deal with private matters of the people. Health is a private matter. Also, under U.S. Title VII Century Rights Act of 1964, it is unlawful to discriminate in a place of public accommodation. I will remind you that UNR, universities, grocery stores, schools, all of those things, banks, everything is considered public accommodations. If it's legally defined as public accommodations, you may not prohibit entry by discriminating against anyone for their medical condition, disability, or religious views. If someone is unable or unwilling to wear a mask for one of those reasons, you may not prohibit their entry, nor may you file a charge of trespassing because of their legally protected status. Just as you would not be able to deny entry to someone based on their skin color or the fact that they're in a wheelchair, you may not deny entry to someone based on their bare face. Thank you.
Thank you for your comments. Erica, I see your hand is up. Can you please unmute yourself and state your full name for the record? You have 2 minutes.
Yes, hi, my name is Erica Neely. I am a mother of 4 children. I have 6, but 4 are school age. And I just want to tell you that I'm against the mandate. I want to also tell you that I'm also speaking for my children. They cannot come in here and speak on this forum, but I can. And I could tell you that right now, this phone call is 5 votes for against mandates. I will ask you to please consider as a parent that I don't want this. My children don't want this. I love my kids. I have my kids. And what you're doing, you're overstepping in my parenting rights. And I just want to just tell you that's it. I just want to tell you that I'm against it. So I hope you consider it. My kids don't want it. I don't want them. I love my kids. I want to protect them. I have that right. I have that choice. And I'm just asking you to respect it, please. Thank you.
Thank you, Erica. Mr. Kevin Dick, you want to go ahead and unmute yourself? You'll have 2 minutes, sir.
Yes, thank you, Kevin Dick. Just wanted to make sure that people in the public that are watching this understand that misinformation is a huge public health threat. And I get all of the deaths that from COVID-19 that are reported in Washoe County come to me in an email. And while we have less than half of our population that is unvaccinated, the vast majority of the deaths from COVID-19 are in people that are unvaccinated. And so clearly the vaccine is preventing deaths. It's not a guarantee, but this is about risk and benefits from the vaccine. The benefits far outweigh any risk. It's a very safe vaccine, and people are literally dying because they are making the choice not to be vaccinated based on misinformation. So I fully support the recommendation that you have from Dr. Azam. Thank you.
Thank you, Mr. Dick. Deborah Songer, I see your hand is raised. Can you unmute yourself? You have 2 minutes.
Can you hear me? The mask mandates, you could get tuberculosis through the mask. So you guys can't say that this is saving us. Also, I want to know how much money you're getting, because we do know the government is getting paid for it, and we know you guys are getting paid for it. We know the doctors are getting paid for it, and especially Medicaid, that Medicaid and that, they give you, if I go and tell them I want a different medicine, they won't give it to me, even though it'll save my life. I want to know why this is an emergency when we have other medicines that we can take that will make us well. Plus, the Nuremberg code, law, whatever you want to call it, you can mandate, you cannot, unless we consent, give us a trial, because we're still in the trial part. Do not give us a trial, make us take it. And if you do, we will take you to court on the Nuremberg. There should not be a mandate.
Ms. Songer, I hate to interrupt you, but do you have a specific comment to this variance application?
I'm telling you, he should be able to. There's no mandate, that is law, period. So you guys can't, I mean, the president did not go through even Congress to make it a law. So how can you say it's law for us to do it when even OSHA can't even do that? That is all I could say. You guys have a good day, and I'm sorry. I get very upset because I have seizures.
Thank you for your comments, Ms. Songer. Monica Marquez, I know that you already gave your comments related to this specific item a moment ago. If you have more comments to give to the Board of Health, there will be a section later in the meeting for general public comments. But I do not see any additional hands being raised by anyone who hasn't had a chance to speak yet. I will hand it back over to the chair, Dr. John Pinot.
Thank you, Mr. Philippi, and thank you for the public comments. Several times it did come up that Comments have been submitted by email, and the board members have received all of those emails, even as recently as 20 minutes before the board meeting this morning. So we did receive every email that was sent in. On this agenda item, I will call for a motion, and then we will have further discussion from the board members.
This is Trudy Larson. I move to deny the variance of Cameron Rose.
Charles Smith, I second the motion.
Okay, it's been moved and seconded. Further discussion. Mr. Rose, we did appreciate your testimony and your application. It does seem it's more of a philosophical thing than anything that you could get a medical exemption if you attempted to, it seemed like, based on what you had in your application anyway. I'm not the doctor that sees you, so is there any further discussion?
It's kind of impossible to get a medical exemption when you can't see a doctor. That'll do it. Kind of defeats the whole purpose.
Okay, thank you, sir. Discussion right now is with the board members. Any discussion from the board? Okay, call the vote. All in favor of the recommendation is to deny the variance, please say aye.
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 Any opposed, please say nay. Any exemption or any abstentions, sorry. Any abstentions? I didn't mean to laugh. Okay, the motion for the variance has been denied. Next item on the agenda is agenda item number 8, approval of requesting all Nevada County Boards of Health to provide quarterly reports to the State Board of Health pursuant to NRS 439.340. And I believe Ms. Julie Peak is going to speak on this.
Good morning, Chair Pennell and members of the Board of Health. My name is Julia Peak and I serve as the Deputy Administrator over the Community Health Services section at the division. Thank you for the opportunity to discuss this agenda item requesting that all Nevada County Boards of Health provide quarterly reports to the State Board of Health pursuant to NRS 439.340. Up until the pandemic, there were a few county boards of health in our rural and frontier counties that met regularly to discuss public health matters in their community. However, once the pandemic occurred, the boards of health really were formed, and most have met at least once, if not much more. And so pursuant to NRS 439.340, the county boards of health are subject to supervision of the division and shall make reports up to the State Board of Health under this relationship. On these informational reports, we would really like them to be very similar to what you heard from our partners earlier at Carson City Health and Human Services, Washoe County Health District, and Southern Nevada Health District. I'll note that many of our rural health officers that serve in this role do have full-time jobs outside of serving in the public health role. And so they may provide the reports in writing versus a verbal report like you've had today. And so I just want to make sure we honor that as well. And so in these reports, like you heard earlier, we hope that it includes information on resolutions recommended by the boards, regulations proposed because that's a requirement, information on new programs, programs that may have changed or ended, successes in their programs, and any challenges that they're facing. I'll note that we also had several rural counties that didn't have a county health officer prior to the pandemic, and now we do have full coverage. And we're also trying to meet with them offline monthly to ensure coordination with those leaders. There are several actually of the county health officers on this call now for the first time probably hearing the Board of Health so that they can understand what is covered and the types of reports that our partners provide. That concludes my remarks, and I really appreciate your consideration of this request.
Thank you very much, Ms. Peak. I look forward to hearing from the other county members if this does pass. Are there any questions for Ms. Peak from the board members?
This is just a comment. Even though we continue to struggle with this pandemic, I think one thing that has happened that's been very positive is the advancement of more formal public health options in the counties that will improve the health for all Nevadans. So like Dr. Pinnell, I look forward to hearing from some of the other counties.
I know there might be a few of the county health managers on the phone. If you have any comment. And is there any public comment on this agenda item? Hearing none, I'll call for a vote for a motion, please.
I'm sorry. Can I still speak?
Yes, please state your name.
My name is Louise Bittner, and I'm the Lincoln County Health Officer. And this is a fairly new thing for this county. I guess there's been a person that's assigned to this, but I have no idea what exact information you want. If they could send out a list of, you know, whether it's just COVID cases or what it is that you're requiring, I'd appreciate that. Thank you.
Thank you. I'm sure Ms. Peak will be in touch with you. Any other comments? May I have a motion, please?
Dr. Morosky, I'll move to approve. Recommendation is made.
Is there a second?
Charles Smith, second.
Further discussion? All in favor of passing this agenda item, please say aye.
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 Opposed, say nay. Any abstain? Okay, motion passes. And I apologize earlier that I could not think of abstaining. Next up on the agenda is agenda item number 5, which is the consent agenda. I would like to pull agenda item 5A. Are there any other objections to the agenda, consent agenda? I would like staff to clarify on page 3 of the staff recommendations for uh, 727 agenda item E. It says 725. Yes, I believe it says 725 and it should read 727. I'm assuming that was just a typo.
Dr. Pinnell, that was agenda item number E. You said variant 727.
Right, and that on page 3 of the staff recommendations, it says case number 725.
We will have that fixed for the record.
Okay, thank you.
I have some questions on item F, so I'm not really sure if this is going in order or not.
Is this a member of the public? Sorry.
Yes.
So Dr. Pinnell, I don't know if typically with the consent agenda, I know the board, if they approve of certain items, they'll approve them all at once. I don't know if you want to call on any public comment related to the consent agenda.
We haven't called for a motion yet. Is that correct? Okay, Elizabeth, please state your name and state your concern.
Elizabeth Hammock, and I just had some questions about item F. I was curious because this has already been approved and signed, and is that typical procedure? Oh, sorry. Is that typical that you would approve something before it was brought before the board, or is this stuff looked over before this meeting? Because you're talking about placing lab clinics on multiple high schools. And I'm just wondering if the parents had been notified, if the parents are aware of the who and the implied consent that if their children are there on a certain day, and maybe this is just testing, but let's just say they decide to vaccinate, that if the kids are there on a certain day, it's an implied consent. I'm just wondering if the parents were given any notice on this since it was already signed off September 29th. And then they were given 6 months from the 13th, which is weird also. And they're being allowed to have these clinics here without licensing or permitting. I'm just curious if the parents of any of these high schools had an opportunity to be notified of this or comment on it.
We do have staff who assisted with this compliance agreement. Brad Waples, I believe, is on the meeting. Brad, I don't know if you can speak to the question. Mr. Schubert, are you available to speak to this at all?
Sorry, attempting to get off mute. I am not able to speak to the question specifically because it appears to be asking whether or not we made any attempt to inform parents of this compliance agreement. And it also appears that there's a notion that the compliance agreement allows for these laboratories to be put into the schools without them being licensed or certified. And I can speak to the second part of that and know they would necessarily need to be licensed and certified prior to actually conducting any testing. And this compliance agreement would allow for those laboratories to receive that licensure and certification. I can't speak to the first part.
Thank you, Mr. Schubert. And for the record, Mr. Paul Schubert, he's our Bureau Chief over Healthcare Quality and Compliance. Dr. Pennell, I'll hand it back over to you.
Thank you. Is there any other public comment? Call the question. I'll call for a motion, please.
Dr. Pennell, we do have a hand raised from Charlotte Stewart. I don't know if they want to, Charlotte, you want to go ahead and unmute? You have 2 minutes to give your comments.
Okay, so it's my understanding that the tests that are used are still under emergency use authorization, as well as they're cleaned with a chemical that over time, if you look it up, yes, other places in the hospital are also cleaned with the same chemical, but you're inserting it far up into your nose and it causes cancer. So I want to make sure that if you guys are implementing these things and having these clinics and stuff, that you are notifying the parents of what could actually happen to their child, rather than just, oh, we have to do this because of COVID. It's the tests haven't even been proven to be effective. Some of them give off false positives. Some of them give off false negatives. So, I mean, how can you guys go through and do this without getting approval from parents? And if the parents don't want to consent to it, what are you offering them so that they don't have to consent? That's all.
Okay, thank you for your comments. Is there any other public comment?
I'm not seeing anyone else, Dr. Pennell.
Okay, may I have a motion, please, on the consent agenda with agenda item 5A being pulled. So this is B through G.
Dr. Morosky, I'll approve, make a motion to approve the consent agenda items B through G.
And I second that. This is Trudy Larson.
Any discussion among the board members? All in favor of passing the consent agenda B through G, please say aye.
Aye.
Abstain? Any abstain or any negative? Mr. Smith?
No, I vote aye.
Thank you. Motion passed. Now we'll go to agenda item 5A that was pulled off the consent agenda. Consideration and approval of variant 721 regarding use of chemical feeders and other disinfecting materials and methods in NAC 441.178 submitted by Carson City Holding LLC. Is Teresa Hayes from the Environmental Health Manager, the Environmental Health Section from DPPH available?
Yes, I am.
Go ahead, please.
Good morning, Chairman Pennell and members of the board. For the record, my name is Teresa Hayes, the Environmental Health Program Manager. I am here today to respectfully ask you to deny the variance from Mr. Begich. Carson City Hot Springs is requesting to modify the variance number 694 provided in September of 2018. Mr. Begich states that the strict application of the regulations would be unduly burdensome and abridge his property rights. Mr. Begich has stated that the modification of the previous variance would give him a greater latitude to modify the temperatures in the pools and spas and to eliminate the costs of automated equipment, which provides the regulated temperature to not surpass 104 degrees. He bases this in his facilities in New Mexico, which are not required to have a turnover rate and are cleaned just every 72 hours. Also in Wyoming, there is no turnover rate and cleaning occurs just every 2 weeks. I called Wyoming to determine why a turnover rate was not required and was told by staff that it is not based on current science. New Mexico did not return my call. In addition, Mr. Begich stated that during our discussions that the Model Aquatic Health Code does not require turnover rates. To clarify, the Model Aquatic Health Code is based on disinfected aquatic facilities and not on waters from natural sources, such as used by Carson City Hot Springs. It is in the opinion of DPH staff that this variance should be denied as it would cause a detriment to the public welfare or impair substantially the purpose of the regulation. Pursuant to your questions, this concludes my testimony.
Thank you very much. Any questions from the board members? Is there any public comment or comment from Carson City Holding?
I do see Mr. Begich has his hand raised, who is the applicant. Mr. Begich, you may go ahead and make your comments.
Thank you very much, and I appreciate the board's attention to this matter, and I thank you for giving me a little time here. We did submit the application. We appreciate what you did before as the 6-hour turnover rate that we currently have. We appreciate. We came in with requesting up to 12 or no regulation, and I want to add a few things and clarify a couple of things. But first, I appreciate the staff. Teresa has been very helpful in giving me as much information. She's under some restrictions, and I'll bring that up in a second on some ideas that we have laid on the table in trying to solve this problem. We have two things. She's absolutely right on the Model Aquatics Code. I'm actually on the ad hoc technical committee for the CDC's Model Aquatics Health Code for the purpose of this issue on the hot springs across the country, because the Aquatics Code does not fully address them. As a matter of fact, if you go back in history, there was some attempt to do it, but they've realized how hard it is because of it's a flow-through system. And I can explain that if you would like more detail on it. I also act as the president of the National Trade Group on Hot Springs Association that deals with hot springs across the country. And I want to give you that just so you have some background of our experience here. We've also operated these facilities since 1998 in Carson City. So it's not new to us of the need and the water flow that goes through these pools. But a couple of clarifications. She is correct in Wyoming, but in New Mexico, and I'm sorry she couldn't connect with them, they eliminated the turnover rate in 2016. In Montana, they have no turnover rate for the very simple reason that flow-through pools, the way I like to describe it is like a bathtub. When you get in your bathtub, you got the water in there, and then suddenly it's getting a little cool. You open the bottom valve, starts draining water, and you bring in hot water. It flows through on a regular basis. That's how flow-through pools work. Very different, 100% different then the pools that are usually the ones that cause illnesses and other things that you read about in the paper. Matter of fact, in our 20 plus years of operating hot springs in Carson City, we have had no issue of disease or outbreak of any kind. Matter of fact, if you look at during the COVID issue, we're very proud to follow the standards of the state when they required us to do certain things with COVID. We had no incident coming out from our customers or our operation, and hot springs that belong to the trade association also had no outbreaks across the country. But we've looked at this issue very carefully, and we're trying to balance it, because what happens is as you move that water in, we naturally cool the water. So as it goes into the pool, if the pool starts getting too cold, we add more water to get our temperatures to keep them in the right space that is required. If they get too hot, then we have to drain the water to get it cool. So it's a very careful balance. But if we're unable to get the right turnover rate, we then have to introduce city water. And in our application, you'll see that it can cost us a lot of money, $5,000 to $6,000 a month if we have to do it. And where this occurs is predominantly in the summertime, because the air is hotter, the water then retains, and we have to balance that very carefully. We understand the safety issue, because if we have a safety issue, we're out of business. You know, our customers pay as they come in. So if we can't allow them in, we are in a world of hurt economically. So we balance this very carefully. In New Mexico, as stated, we have no regulation, but except testing and cleaning, notification, and ensuring that the customer is well aware of what we do and how we maintain the facility. Carson Hot Springs has been around since 1849. It's been around a long time. We have taken this property from, frankly, back in the day when we bought it, the past owner should have been dealt with by the health department, the Board of Health, in my personal opinion, but we have upgraded this facility significantly. We've invested a lot of money, and also the statement that we are avoiding automatic temperature control equipment is not correct. That may be just a misinterpretation of our application. We have automated that equipment. And the reason why we've automated to very carefully balance the water temperatures, but also the consumption of water. You know, the past user or owner of this facility has wasted water. And our water, when we discharge it, and it goes, like I said, it comes through, and each pool is separate. No pool uses the other pool's water. Every pool gets their own water. It's discharged out, and it feeds the Carson City wetlands. Without our water, the wetlands would dry up, basically. So we are in a unique place where we want to balance the water, treat it properly, but make sure it is natural in its aspect. And so we suggested, you know, to eliminate or get us to a 12-hour cycle. When I read the response by the department, and they said between 6 and 8 hours, I quickly suggested, okay, if we get 8 hours, we'll get 2 extra hours, which helps us balance this temperature issue. But because of the way the Attorney General has given the department guidance, they can't change our application, even though we're the applicant that is saying, okay, we're reading your report. We don't agree totally with it. I'm just going to be blunt about that. But if they're recommending 6 to 8 hours, we'll take the 8 hours. That helps us. Every hour we get lowers our cost of city water, which we do not want to waste that city water. And we don't, frankly, it's very, very expensive. But we have very high health standards in our facility. So let me end there. The flow through water pools are a new phenomenon. And I mean that in the sense that they have been around for a long time, but regulators are starting to figure out or not of how to deal with it. And that's why we're now on, I've been asked, I'm serving on the ad hoc technical committee for the CDC for the Model Aquatics Health Code to help resolve this issue. They're very motivated because they see the challenge of regulating these and they want to figure out the right approach. And we think we've done it well for 20 some years. So let me end there, Mr. Chairman. I'm happy to answer questions, and, you know, we're happy to work with the department, but, you know, we might be caught in a box because the way the AG has suggested to staff, you know, every hour we get on our turnover rate is a benefit to the use of the water and the temperature control and cost. But safety is our #1 priority. Without it, we're out of business.
Okay. Thank you, sir. Ms. Hayes, can you respond?
To clarify, Mr. Pennell in Carson City Hot Springs already has a 6-hour turnover rate. That was what the variance granted was number 694. So he already has that 6-hour turnover rate. I don't think the same amount of homework went into it when we gave him the original variance that I did. And we would be willing to discuss an 8-hour turnover rate if we can get some data from Mr. Begich in Carson City Hot Springs to look at not more than 8 hours, except we're in spas, that would, significantly reduce the number of turnovers and they are not cleaned in between clients as required by Nevada state law. And so we think we need to separate up whether or not it's a pool or a spa and based on the number of gallonage in order to make this thing work. And we'll certainly work with Mr. Begich to try to figure out how we can do that effectively and still maintain public health.
Mr. Chairman?
Yes, sir.
This is the problem with the understanding of flow through, and all due respect to the health professionals and the folks here, we have operated these, the best data is we have operated these for since 1998. Prior to that, since 1849. There is no record of a health issue caused by these pools. Not only that, the flow through pools around the country have not had these incidences that are being claimed. And spa, this is the problem. When you think of a spa, you think of a hot tub. Well, that's not what this is. These are flow through pools in different sizes, small ones, large ones, middle-sized ones. And the minute you say we're going to add a bench into the pool, it is considered then a spa, which is irrelevant to the definition of a spa. These are pools that have benches or no benches. And actually, if you recall, or you may not recall, I apologize, on our request, there was extensive work done. And on top of that, the first request, on top of that, we had to get a exemption to put benches in, despite the fact I can go to Hawaii and see pools with, for example, benches in it, because the definition is, in my view, not clear when it comes to flow through hot springs pools. Hot spring pools are different size facilities that have both jacuzzi style movement of water as well as benches, or some without benches, some are just waiting, some are 3 feet, some are 5 feet. It varies. Trying to fit them into the classification that recirculation pools are does not make any sense from the sense of the operators. And I appreciate.
So I'm going to go ahead and stop you for.
Sure, no problem.
I'd like to take a 10-minute. We'll take a 10-minute recess and we'll reconvene at 10:54. The board will reconvene at 10:54.
Thank you, Mr. Chairman.
Thank you.
All right, thank you, everyone. It is 10:54 a.m. I'm going to go ahead and take another roll call of the Board of Health members just to make sure we still have quorum and can move on. So starting with Chair Pennell, are you present?
Present.
Thank you. Dr. Morosky,
Present.
Dr. Ponce,
Present.
Mr. Smith,
Present.
Ms. Bittner,
Present.
and Dr. Larson.
Present.
Thank you. We have all members present and we have quorum. Dr. Pennell.
Thank you very much. We're still discussing agenda item 5A, and if I may maybe suggest to the board that we could take a vote to table this and give the applicant some time to consult further with the state. Before that, is there any other additional public comment from?
I don't have anything else, Mr. Chairman.
Okay, thank you, sir. Hearing no further comment from the public, may I have a motion, please, for agenda item 5A?
Yes, Charles Smith, for agenda item 5A, I make a motion to table this item to allow the two to get together and review and see if they can work out some further details on this.
This is Judy Larson, I second.
Further discussion from board members? All in favor of tabling agenda item 5A, please say aye.
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 Opposed, nay. Any abstentions? Thank you very much. I think we're now on agenda item number 6. Consideration and adoption of proposed regulation amendments to the new regulations governing food establishments passed by the Washoe County Health District Board of Health. This was voted on and passed unanimously at the October 28th WCHD board meeting. Michael Toohey.
Yeah, can you guys hear me?
Yes, thank you.
Hi, good morning, Mr. Chair, members of the board. My name is Mike Toohey. Senior Environmental Health Specialist from the Washoe County Health District. I'm here to present on the consideration and adoption of the new regulations governing food establishments in Washoe County. In October, the Washoe County Board of Health voted on and unanimously passed these new regulations. Just to recap, the major changes in this regulation update were the addition of term limits to those serving on our Food Protection Hearing and Advisory Board, a new chapter dedicated on catering operations, and updates from the supplement to the 2017 Food Code that was published in 2019. Before the regulations were presented, the food safety team at Washoe County conducted public workshops, both in person and virtually. At the conclusion of the workshops, we did not receive any negative feedback, and attendees were receptive to all the new changes. With that, I would be happy to answer any questions from the board.
Thank you, Mr. Toohey. Any questions from the board members? Hearing none, is there any public comment on agenda item 6? Thank you, sir. May I have a motion, please, on agenda item 6?
It's Dr. Morosky. I will move to approve agenda item 6 as presented and thank the department for providing a great written summary of all of the changes in detail to review ahead of time.
Dr. Ponce, second.
Thank you. It's been moved and seconded. Is there any discussion among the board? All in favor, please say aye.
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 Opposed, nay. Any abstain? Motion carries. Agenda item 7, consideration and adoption of proposed regulation amendments to Chapter 422 of Nevada Administrative Code NAC regulations for the certification of tenancy support services, which is authorized under NRS 422.3964, 433.324, and 439.200. This is LCB file number R030-20. Mr. Stephen Wood, please.
Thank you, Mr. Chair and members of the board. Can you hear me okay?
Yes.
So with me today are Don Yoy from DPBH, as well as Mark Disselcone and Nick Tangeman from the Center for the Application of Substance Abuse Technologies to help answer any specific or technical questions that you may have. Today, we will be presenting R030-20 for your approval. This regulation was developed by the division, working with stakeholders and CASAT to amend NAC Chapter 422 in an effort to establish standards of service and create a mechanism by which Medicaid can reimburse for tenancy support services. This will be accomplished by the establishment of a program for the certification or recertification of providers of tenancy support services, including the application process, certification fee, provider qualifications and duties, and technical assistance. Tenancy support services are defined in NRS 422.3964 as services authorized pursuant to federal law that assist a recipient of Medicaid in obtaining and remaining in housing the division determines to be adequate. These services are intended to help those dealing with behavioral health or substance use disorder issues, among others, find and maintain stable housing, many of whom have been impacted by Nevada's housing crisis. The certification process will be very similar to others administered by the division. The fee for certification and recertification is set at $100, and the regulation sets the specific requirements for a provider of tenancy support services to be certified by the division. Those requirements include having a designated operator, having policies and procedures, confidentiality of records, employment requirements and records, liability insurance, and qualified supervision of staff. R030-20 also requires certified providers to report certain things to the division. Those things include any changes to their program that might affect their certification, any incident that could put a client, employee, or visitor at risk of harm, as well as the death of a client during the provision of services. The regulation also outlines the grounds for the division to deny an application or revoke a certification, as well as the appeals process in the case of a denial or revocation. A public workshop for this proposed regulation was held on September 30th. Only one member of the public offered comment, and they said that they were grateful that the division was moving forward with this regulation. So with that, we respectfully request that the Board of Health adopt R030-20, and we would be happy to try to answer any questions that you might have.
Thank you, Mr. Wood. Are there any questions for Mr. Wood from the board?
Yes, I have a question. Could you give us an example of who might be providing these kinds of services?
So with that, if I could call on our friends at CASAT who work with the individuals that will be providing these services to help give you more information about the provider.
Thank you.
Hi, I'm Nick Tangeman from CASAT. Mark Disselcone is not here yet. He's traveling, but he's hoping to jump on by now. So a lot of the providers in the area in Southern Nevada and in Northern Nevada are already providing similar housing services. There would be organizations in the community. A lot of them are providing substance use and or mental health services.
Also, if I could jump in, Dr. Larson, as part of the regulation, there is a requirement that the providers who apply for certification have to have 2 years of experience providing these services, since we haven't had certification prior to now. So the providers that will be certified will have experience providing these services.
Thank you. That was very helpful.
Thank you. Any further questions from board members? Is there any public comment on agenda item 7? Hearing none, may I have a motion, please?
Charles Smith, I make a motion to adopt resolution R030-20 as submitted.
This is Trudy Larson. I second that.
It's been moved and seconded. Any further discussion? All in favor, please say aye.
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 Any opposed, say nay. Any abstention? Motion carries. Thank you again, both Mr. Benjamin and Mr. Wood. Thank you.
Thank you.
Item 9, discuss and vote to designate a member of the State Board of Health to serve on the State Environmental Commission, SEC, pursuant to NRS 445.200F. This was in our board packet, the information about the State Environmental Commission. We have had one member express an interest in this. Mr. Smith.
Yeah, Charles Smith. Yes, I would be very interested in sitting in this position on the board. I'm concerned about the environment and health and well-being as far as being the Board of Health. I'm also related, in the construction industry, so I think it's important that we protect our natural resources.
Thank you. Is there any other discussion? Any other board member have an interest? May I have a nomination, I guess, or
Yeah, Dr. Pennell, I'd like to nominate Mr. Smith. He has the background that I think would be best suited to serve the bridging between the two boards, and his desire to serve is admirable. So I nominate Dr. Charles Smith, Mr. Charles Smith.
Dr. Smith has been nominated. Are there any other nominations? Nominations are closed. All in favor of Mr. Charles Smith being on the SEC, please say aye.
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 Any opposed? Congratulations, Mr. Smith, and we thank you for your service. We really appreciate you volunteering to do this. We know you'll do a great job. Thank you.
Thank you.
Agenda item number 10, approval of the proposed 2022 State Board of Health meeting dates. We have March 4th, June 3rd, September 2nd, and December 2nd. Is there any board discussion?
This is Joseph. For the record, I'd just like to, just in case you all don't have a calendar in front of you, these are consistent with when the board usually meets, the first Friday quarterly throughout the next year, in March, June, and September and December. So if you approve these dates as proposed, it would be consistent with what you have been doing in years prior.
Thank you. Is there any public comment? We have a motion, please, for the proposed 2022 State Board of Health meeting dates.
Dr. Morosky, I'll motion to accept the dates as proposed.
And I will second.
Moved and seconded. Is there further discussion? All in favor, please say aye.
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 Any opposed? Motion carries. The dates are set. Agenda item 11, recommendations for future agenda items. Board of Health members.
I actually would like to propose that on our agendas, we have a little report from Mr. Smith about what is going on with the Environmental Committee as well.
Thank you. I think that's a good idea, and we can add that to the agenda. I'm not sure when their next meeting is, but I know they meet 3 to 4 times a year, so thank you.
And Mr. Smith, this is Joseph for the record. We do have representation from the Division of Environmental Protection on the call, so I can go ahead and connect you after the meeting so that you guys can coordinate on that quarterly update to the Board of Health from the commission.
Okay, very good, thank you.
Any other recommendations? Is there any public comment? Agenda item number 12 is general public comment. We'll be under the same guidelines as we were before, that you'll be limited to 2 minutes. This can be any topic. All the written and emailed comments that have been received by the Board of Health members, as I mentioned earlier. Use of obscenities or other behavior which disrupts the meeting to the extent that its orderly conduct is made impractical may result in the forfeiture of the opportunity to provide public comment and removal from the meeting. The public comment period is now open for any subject. Joseph.
Thank you, Dr. Pinnell. I do see Casey Rogers has her hand up. If there are anyone else wishing to make general public comment today, you can raise your hand through the computer platform, or you can press *9 if you're joining by the phone, and that would raise your hand. But we'll start with Casey Rogers. You'll have 2 minutes. You can go ahead and unmute.
Casey Rogers, for the record, the Nevada System of Higher Education under Health, Wellness, and Prevention stated in July 27, 2021 that, and I quote, "There is currently no vaccine for coronavirus," after they already implemented that they were going to be maintaining this vaccine. So I would hope that the gentleman who was on here prior seeks legal counsel, and I am willing to help donate to that fund. Also, apparently you don't open emails. So since the Board of Health is a public entity, you are subject to Nevada Open Records Act. So here is my FOIA request. I want full proof in your words that were said earlier match the evidence that is what you said information is misinformation. To start, proof that COVID-19, SARS-CoV-2 actually exists. And that it has been isolated. Proof that they do not cause COVID-19 or the like. Proof that you have given informed consent to all of its ingredients and adverse effects and the like to all participants in this experiment, as well as those considering it. Proof that there is no other therapeutics in use in our country that are either preventing or curing those who have contracted SARS-CoV-2 or coronavirus C-19. Proof that this is not a gene therapy. Proof that the CDC did not change or try to change the definition of vaccine within the past 2 years. Proof that masks work to prevent the spread of coronavirus C-19, so SARS-CoV-2, and the spread that it was stopped when it was implemented. If there is any cost over $100, please inform me. However, I would like to request a waiver of these fees, as your department is the one making claims that should be verified that by we the people, as we are in the best interest request. And if it takes longer than 30 days, I would like to be notified. I will be also sending you in this email. You may want to check it. Thank you.
Thank you for your comments. We'll move on to Elizabeth. You can go ahead and unmute and state your name for the record. You have 2 minutes.
Elizabeth Hammock. You all seem very kind and highly intelligent. And pardon my emotion, but I came across this yesterday, that by you accepting funding from any form of the COVID relief plan, that you will automatically agree to any existing or future directives and guidance, including to the point of quarantine and isolation. And sadly, I see Australia in our future. Let me put my video on. I'm wasting my time here. Okay, I see Australia in our future. But here's the deal. The testing is completely discriminatory. You need to fix that. The unvaccinated are getting tested far more than the vaccinated. In my husband's fire station, 2 guys got very sick from COVID that were fully vaccinated, and they were allowed to go back to work when they felt better. However, the contact traced unvaccinated had to quarantine for 10 days, even though they never got sick, and test to go back. Completely unfair. Naturally, that will raise your unvaccinated numbers overall. And really quick, the state report You cannot say that vaccine is safe and effective anymore. It is completely experimental. As Pfizer has stated, they want till 2076 to release all their data. You also are setting us up for perpetual mask wearing by saying, oh, we have to address influenza and norovirus and gastrointestinal. So we're going to wear masks forever? What about our children and grandchildren? Don't you care? You guys need to stand up and get out from under this, and women too. I apologize. You're putting people in a state of hypoxia, low, but all day, which will lead to future problems. And last but not least, she mentioned, or he, natural immunity. Well, I have a FOIA request from CDC that states they are not collecting that information. You know nothing about natural immunity. Look at Harvard, they did a study. Look at Stanford, they did a study.
Thank you for your comments. Charlotte Stewart, I see your hand is raised. Can you go ahead and unmute? You have 2 minutes.
Okay, so earlier it was said by, I believe his name was Kevin Dick, that this was all misinformation and that people unvaccinated, more of them are dying from COVID. But there has been multiple whistleblowers from the hospitals saying that it is the protocol that is killing people. The remdesivir is killing people. They are treating unvaccinated with remdesivir, and they treat vaccinated differently. Their whole purpose is to drive up the numbers of positive cases in unvaccinated and positive people dying that are unvaccinated so that they can convince them to take this vaccine. What about the vaccinated that are dying from heart complications? What about the vaccinated that can't walk because they have Guillain-Barré? What about the vaccinated who can't stop moving and they're twitching and they have neurological problems now, or cerebral palsy? What about those people? Just because it's not COVID, it's not getting reported. They're like, oh, well, it works for COVID. That's not necessarily true. It's the way that you guys are manipulating the numbers. And if it's not you guys, it is somebody in the CDC that is doing it. But the point is you guys don't have to go along with this. You can stand up. You can tell them you don't want the money. You have that option right now. But if you go with them and take this money, you are no better than a murderer.
All right, anyone else wishing to make public comment, please raise your hand. If joining by the computer, press *9 on the phone.
I would like to, but I don't know how to raise my hand. I've been looking for 20 minutes.
No problem, Valerie. You'll have 2 minutes. Go ahead.
You know, the previous speaker gave some important information, and it's about the money. And the board members who are discussing this topic right now, they need to admit that it's all about the money. There claims to be medical doctors who took oaths at the beginning of their career. They're absolutely disregarding those oaths. This is about the money. It has been from the beginning, and it's leading people who I assume were good people before this all. It's leading these people to be unethical monsters. I don't know what kind of evidence, as scientists, you claim to use evidence to make judgments, but as scientists, you're refusing to look at the real data. I read something online the other day that said when there are problems with lettuce, salmonella, whatever, they halt the distribution of the lettuce immediately. 3 deaths makes an immediate stop to distributing that lettuce. Well, how many deaths have come from this supposed vaccine? And yet they're marching forward. It's because of the money. The money that Big Pharma gets, that pays CDC, the money that the counties are getting, the Board of Health are getting. You're selling out your country. You're selling out the rest of humanity. You see what's coming down the line with Australia, and you're refusing to stand up with any sense of integrity or humanity in yourself to stop this. It's about the money, and that's what you care about, your position. I'm just disgusted. that people in your position are continuing on this pathway when you know it's coming. You need to stop these mandates. Stand up. Be human.
Anyone else wishing to make public comment today? Please raise your hand. Ms. Enking, go ahead. You have 2 minutes.
Just in response to the last speaker too, I just want to, this was Pfizer's report from the third quarter of 2021. The third quarter of 2021 revenues of $24.1 million, reflecting 130% operational growth, excluding community. Revenues grew 7% operationally to $11.1 billion. The full year revenues are 81 to 82 billion, and reflecting a 94 to 84% year-over-year growth. You know, I'm not a economic, so I'm just reading this. Pfizer, BioNTech, and Moderna are making $1,000 of profit every second, while world's poorest countries remain largely unvaccinated. And the US has had the largest amount of deaths throughout the entire world reported in the last year since the vaccine rolled out. So I just wanted to give people some insight as to, yes, it is about the money. Thank you.
Thank you for your comments. Renee, if you could please unmute and state your name for the record. You'll have 2 minutes.
Hi, this is Renee Chaffee once again. I just want to state for the record that I strongly oppose all these mandates coming down. I also want to make a comment that Kevin Dick, when he said that we are receiving our emails, I have email tracker. The email has not been opened up since I sent it on Monday, and I sent another one adding to my comments today, and I see that it's received, and once again, it has not been opened up. So I just want to clarify to the public that if you're like me and you were just sending emails, they're not being opened up. Once again, I'm a very highly educated person. I have a master's, and I am confused, honestly, by this agenda item. What does this mean? Consideration and approval of variance 728 regarding the COVID-19 mandate for Nevada System of Higher Education. Are you trying to get rid of our Nevada administration code that already says people are entitled to higher education, even if they don't get vaccinated? Like, is that what this proposal right now that you guys all approved without listening to any of the people who elected you? It's very, very, honestly, this is confusing to read, and I still don't understand it. And I've been listening to everyone speak. I really do think you need to have a more dynamic board, or maybe we need to elect people, right, that say both sides to every situation. There is no medical product that does not come out without risks. You cannot mandate people take something for their safety when it's not proven to be safe, period. Government does not get a say on what our children have in their body or whether they get to receive an education. Parents do. Parents will do anything for their children. Let parents decide what is going to be injected into their children. That's all.
Thank you. Anyone else wishing to make general public comment today, please raise your hand. Dr. Pennell, I'm not seeing any additional hands being raised.
Okay, thank you, Mr. Philippi. I appreciate it. That concludes our meeting today. I'd like to thank the Board of Health members and thank all the staff of the Department of Health and Human Services Division of Public and Behavioral Health. Thank all our public members that took the time to call in today. Wish everyone a very happy holiday season, and this meeting is adjourned. Thank you.